journey of change for Pavilion 3 at Ayrshire Central Hospital began in November 2014 with the appointment of a new charge nurse. Before my appointment, P3 had no permanent charge nurse, low staff morale, was without a team ethos, they'd received high numbers of written complaints and staff sickness absence was over 20%. P3 was a difficult environment to work in. It had drafty, leaky windows, a leaky roof and faulty heating. Moving to a new build in May 2016 seemed a long way away. We had an elderly rehabilitation ward with no admission criteria, extended length of stay and often a high number of patients who had complex care needs and limited rehabilitation potential. P3 nursed palliative, sick patients who needed to transfer back to acute hospital care as well as patients requiring long-term care. This situation was difficult for the nursing staff who didn't have the diverse range of skills needed to care for these patients, as the team had little or no investment in their training needs prior to me arriving. P3 was a traditional consultant-led model of care supported by ANPs and FY2. As so, we started down the long, winding and sometimes bumpy road of change. With strong leadership and investment in staff through training and development, changes and improvements started to become evident. To me, the key to success was through us as a team, not through me as a leader. Team working began to improve. A fundamental key to change was a rapid improvement week in June 2015. A significant factor of this week was good partnership working between all professionals from ward staff, district nurses, social workers, mental health nurses and AHPs. Our aim was to ensure we had the right patient in the right place, supported by the right professional at the right time. So we developed admission criteria and a decision support tool for all referrals. This helped shape the way forward, taking us into the future. Since then, we have developed close working relationships with our colleagues in acute hospital services, social work teams and care at home and intermediate care teams. This has enabled seamless transitions from patients from acute to rehabilitation to home or homely settings. With good team working and development of services, we have increased our admissions by 30% and reduced our length of stay by approximately 12 days. Since November 2014, when we started this journey, we have had no written complaints. We have reduced our sickness absence to 5%. The team ethos has turned around 360 degrees to a team who now take a huge amount of pride in being a flagship for change. We now have a collaborative and cohesive multidisciplinary team that works effectively with the patient's best interests at heart. We are now in the beautiful new unit in Woodland View, Ayrshire Central Hospital, where all our patients now have single room with ensuite facilities. It's a lifetime away from Pavilion 3. Staff continue to receive the appropriate training and professional development. A new GP-led medical model will be supported by ANPs to enhance the quality of rehabilitation and intermediate care to people in Ayrshire. From the end of 2016, we will admit patients directly from community teams who need the skills and input from Ward 1. And our journey continues. Ward 1, Woodland View, is on an upward spiral towards being recognised as a leader in intermediate care and rehabilitation services for patients.